could stop real simply with bed nets, with certain types of treatments. Again, there's even these little devices, little sheet of paper you can put in your room that will repel mosquitoes. There's a lot of cool technology out there that's very cost effective in saving lives, and we're talking millions of lives here. And even places like where I'm at, Mount Hagen in the highlands, which is at altitude, we're seeing cases of it because with climate change, with maybe mutations or something like that in the mosquitoes, but we're seeing them at a higher altitude now, which is kind of scary. And just a note on a more of a U.S. side, there's 3 homegrown cases of mosquitoes biting people and having contract malaria as close to home as Maryland and Virginia. So just kind of keep that in mind that it's on the rise with climate change. Regardless of the fence you are in the politics, it's something that's going to happen and we need to address. And we just hope that we could start in a place like this. I think Papua New Guinea is a place that I think, correct me if I'm wrong, Dan, but it's a place where there's a high potential for us to actually eradicate, and that may be the reason why projects like this could help. And because it's an island country, because there's a way for us to actually have effective results, even though we may not get the massive number of deaths that are occurring, like in the mountainous number of cases that are occurring, like in places like sub-Saharan Africa. Place like this is a place we could actually finish off malaria and actually accomplish and actually get it done, and that actually is a huge step. And if a country like unfortunately, like a resource limited country like Papua New Guinea is willing to provide that kind of cash to support this, we need to jump on it because we may not get this opportunity again with the type of government to support. So something to consider. And obviously, I'll definitely take this back home. And again, this is kind of a new, relatively new kind of project, but I think it's something that we could kind of go hand in hand with our efforts to end polio. It's something that I think it's some people have said it's like the next thing, right? And I agree. And it's something that's a different type of disease. It's definitely they are working on vaccines. They did have Daniel was involved in the rollout as well, and it's very effective way of treating it. But I think it starts with Rotary again.
Well, we have 2 vaccines that have been approved. The R21 vaccine is rolling out in Africa right now. I'm going to be in Uganda in August and Kenya and Tanzania and take some videos of vaccine clinics. And we're going to try to put together like a YouTube for our Rotary Action Group. But basically, we're trying to coordinate with clubs on the ground to come together and give support. And we're going to start with a fundraiser. I mentioned that we already gave $100,000 to TRF. We've got a QR code that you can just take a picture, with your camera. It takes you to a website. You know how that works. And then that website, you can donate money to the malaria cause. Our first major fundraiser is going to happen in October. So the first thing I would invite all of you to do is to learn more about malaria. It's a mosquito-borne illness. It affects about 50% of the population in Papua New Guinea currently. It causes about 600,000 deaths in Africa. 95% of the deaths are in children in Africa. A few percentage are pregnant women who get complicated malaria as well. So we have some really good tools. James mentioned the mosquito nets that are insecticide impregnated. They work really well. If you sleep under those nets, you drop the mosquito rate in the bite rate in a village by more than half, and you drop the malaria down a similar amount. We have these panels that are like the old-fashioned fly tape, that twirly thing you used to hang out on your back porch to catch flies. Well, now they have like a panel that's 1 foot by 1 foot. You hang it up for a year, it catches mosquitoes and it kills them. So we have some interesting technology. We have a lot of energy in Rotary, and the power of Rotary is if we can train all these 2,100 community health workers in Papua New Guinea and we get this program of scale, we're going to need a lot of support from clubs around the world. Our last big push in malaria from our group was in Zambia with the program of scale 5 years ago. It ended 2 years ago. We trained almost 5,000 community health workers all across Zambia. We brought Rotarians over there on several, I think 4 trips. And now I'm on my 12th trip to Africa. So it's an exciting time in the world where we can actually make a big impact. And, people we don't know, but service above self is one of our big deals in Rotary, right? So I don't know what happened to my friend, Dr. Munier, but I thought he would be on here by now. James, are you still there? Oh, there you are.
Yeah, I'm trying to get back into that other Zoom meeting to get him over here, but it's kind of difficult. I apologize. I think, Daniel, I think I texted you the wrong another link, and I actually fell for that trap myself. So that's why he and I were in that Zoom link. I apologize. But if you could just refer, if you could maybe get him that email link. But it's actually really cool to meet the person in country who's actually implementing the project, and it's
Yeah.
and I think putting a face, I think the Zoom technology is really helping us do that, and it's a real treat. And again, if the team here can't meet him, that's okay, Daniel. If you don't mind, maybe the three of us could connect later and
Let me try one more
get some more
time
details. Okay,
because I
thanks.
did I did send him the link that I thought I was on now. So
And and just to, so I know some people joined in later. And I'm sorry for not formally introducing you. Dr. Perlman is actually an infectious disease specialist based in Colorado. He's kind of done a lot of academics, but mostly, I'm assuming, Daniel, no offense to your age, but towards the end of his career, he's now focusing on giving back to the community quite a bit. And he's actually the head of Rotarians Against Malaria, which is a major action group, and it's quite a big for how little they are, for how big, for how much impact they've made. It's pretty impressive, and it's really a testament to Rotarians, people of action, and he's really committed to service above self. So this is like a hero to all of us. And we met as part of a group that went to Washington D.C. in March to actually advocate for malaria funding, and we got to talk to our congressman, et cetera. But Daniel and his wife, just amazing human beings, just really taking the charge and putting a face to the cause and doing a great job with it. So just want to give a big shout out to Daniel for taking this time tonight. I know it's real late where you're at too, so I appreciate joining on. Thank you.
it's 9:46, so it's not too bad.
Yeah.
Um, and I appreciate your support. We really have a lot going on now. This program is ramping up. We're really getting the infrastructure organized. So now we need to educate Rotarians about malaria and how we can build the toolboxes out in the villages, in the remote areas. Papua New Guinea could be a place, the national place it could be eradicated. The national program for elimination is supposed to get it down to close to zero by 2030. So we have about 5 years. If we could do this program that I'm talking about, we could really speed this thing up and make a huge difference. And there's a lot going on in Papua New Guinea in mining. ExxonMobil is there, there's gold mining, etc. So there's workers that are coming and going in the country, and so it spreads it to other islands in the Pacific. So we have this thing called cross-border transmission. We need to work on that. And by putting up this program, I think that would make a big difference as well. And I'm trying to find the right Zoom link. I'm sorry. That is a little bit elusive right now.
Daniel, when you're looking at Hawaii and District 5000, and I'm sure James knows more is about this, we'd really need to know, are you looking for money? You're looking for us to put our Rotarians that might come out there and volunteer to help with the workers and the trainers or something of that sort. And what would we need to know, and what would we need to, I'm sure need to be immune, having already been immune so we don't become sick and carriers of the problem. So, because did you say 50% of the people in Papua New Guinea do contract malaria
In a year,
in a
yes.
year? Wow,
Yeah.
that's a
So it's
lot.
very common. It's the most common cause of fever. The type of malaria that is there is luckily not the type that's fatal generally, like the kind in Africa. but it is malaria nonetheless. And the thing is, we're, like I explained at the beginning, we're just in the beginning of this, putting in this program of scale concept note. It has to get reviewed. If it gets approved, it will be announced in Calgary, and then the program will go into the implementation phase. So right now, we're just doing general fundraising for malaria programs in 11 countries. And I put on our website, I'm sorry, I put on your chat box the website. I'd like you to go on there and join up. It's a free newsletter. Lanier's calling me on the other line. Let me
Okay.
try and
Yeah,
get.
connect, catch him.
Hey, I'm on the Zoom right now.
Me too, but
You're on the wrong. You're talking to the wrong Zoom. That's the problem. Uh, we had a little mix up there. Do you want to try to get on the correct one?
okay, I can do that. Yes, right now.
Do you have the new one that I sent you?
Yes, I have. Thank you.
Okay, let's see if he gets on. Thanks. Everybody listening to all that chatter? Sorry.
Is he Lorenzo? Is that his name?
No, he's
No? Okay, well, do we have
Yeah,
another?
that's a different doctor coming on.
Okay,
But
so another MD,
no
okay,
worries, no worries. There he is. Returns Against Malaria just joined. That's him.
okay,
There he is.
okay.
Sorry.
No worries,
I
doctor.
was-
No worries.
I was in a wrong meeting. Sorry.
Yeah.
Right.
Sorry about that.
No,
So,
that's okay.
James, do you want to introduce Dr. Munier, or do you want me to?
You can. I've only met him for 5 seconds in the other Zoom meeting.
Oh, okay. So he's been working with me on this program of scale project proposal that we're submitting to Rotary International now. And he's basically put together the foundation for this project to explain it to Rotary, because it has to be approved, and that's going to be an almost 1 year process. Dr. Munier, would you like to tell people your viewpoint on it quickly, and then we'll do some Q&A? I told them a little bit about it before you got on.
No, thank you, Doctor. This project is basically to cover the most distant and most needy communities in PNG at the most far-flung areas with high burden malaria. So we tried with this project in 2023, but we could not submit the proposal. Now that there is a US funding cut and there is a declining funding trend from Global Fund, we truly need to get this support from whatever organization or foundation. So what Dan and Jenny helped me is to prepare a very good concept note. I should say it's good because it has been presented very nicely. And the problem is clearly probably would be understood by the selection committee. So overall, there are 4,000 such communities. They are at least 1 hour walk away from the nearest health facility. And unfortunately, many of them could never reach the health facility because there is no transportation and difficulties and securities around, female people going, women going to the center, all those things. So currently, through the Global Fund, we have 1/4 of those 4,000 villages covered. And through this Rotary grant, we are trying to reach another 1/4, which is 1,050 villages. So this is all about the project. The funding support will come from National Department of Health because they have a core budget for malaria response, which includes support to RDT and ACT and their technical officers. There are 2. they can actually monitor the program by actually visiting the sites and by talking with provincial health authorities and district health authorities. That's the design. From RAM, we already have the same program in another one-fourth of the country. So this expansion is within 10 existing provinces and two new additional provinces. So it's like an essential program, and Rotary is ready. So from the Global Fund platform, they have 2 million in the current grant, which ends in December next year. And we do not know what would be in the next grant, which is Global Fund Grant Cycle 8, but we know that HMM will be there because uh, it's an essential part of the national strategic plan, which is which is going to be approved in next few days. We completed drafting it today, and it will be approved by the next TWG. So many things going together. It's a very crazy time here. Our API is very high, extremely high, and local level transmission is very high. And we have not progressed since 2015 due to various reasons. So I will stop here. If you have question, I can answer.
These people are Rotarians, but they don't know what API is, and that has to do with the burden of disease in the country. Just you used a few different acronyms that weren't that helpful for this group. But what we're trying to do is introduce you to the group, tell them that they can help as Rotarians. All these people are in Hawaii, and
Okay.
they're in a variety of different clubs. So I said that we're going to be having this fundraiser, and then I gave them the link so they can get on our newsletter and join our Rotary Action Group. And the fundraiser is going to happen in October. You just look on it. We're doing a virtual Flexi goal fundraiser. So when I say Flexi, anyone can do whatever they want. You set your own goals. If you want to bike 10 miles, you can donate money, $10, $100. You can find 10 friends who give you $10 for doing that 10 miles. If you want to do swimming, if you want to do rocking chair stuff or walk around the parking lot with your buddies at the nursing home, we don't care what you do. It's up to you to figure out what activity, but it's around propulsion mostly. And you donate money on this QR code. All the money goes to malaria projects, 100%. Thank you. Nancy, should we take
Yes.
some questions?
Well, I think I have nothing but questions because, of course, this is fairly new. I have heard, of course, I think I'm getting emails too about Rotarians Against Malaria. Of course, as the new district governor, I'm getting inundated with things every minute of every day, and I'm living in an airport practically, traveling across the state, visiting my Rotarian clubs. So a little bit of overwhelm. But so I'm pretty much going to be looking to James. Did we lose him here? And our committee to see what kind of action they're going to want to try and direct our district to what we can take on and what we have the bandwidth to. Sounds like Murray's here. He said he was working with you folks in Papua or with a project in Papua New Guinea. Is that correct, Murray? Were you over
Yeah,
there?
well, this was a WASH project.
Oh, okay.
Mhm.
So Dr. Munier, WASH is around water and sanitation and hygiene, and
Yeah.
Rotary has 7 pillars that we work in, and that's another one apart from disease prevention. So good work, Murray, doing that. I know they need that in Papua New Guinea. And James Ham, who's was on a moment ago,
Yeah.
he's working on trauma because so many traumatic deaths happen in Papua New Guinea. And he's over there right now in Port Moresby. So,
Yeah.
Nancy, what would be the best way that we can kind of build the interest in this, in your opinion?
Well, I've got your your website that you put here in our chat. So I've marked that down to go into that very soon here. And then I guess the thing would be sort of what you would say would be our call to action. Now you're saying tomorrow is your deadline to submit your request to Rotary for funding, Rotary International. You've got a request going in there.
For the program of scale
Uh-huh.
project, which is, over $4 million that will get approved during this year, hopefully, if
Okay.
they bite. We don't know. There's a chance that they got a whole bunch of people submitting. We don't know the details. But we put together a very nice proposal, and the Pacific area has not done any programs of scale. We think that's a big advantage, of course.
Okay.
So
That sounds really good. So would it be more reasonable to think that particularly if you were to get that Rotary 4 million or a large portion of that, that would make our involvement even more important since we're here in the Pacific Basin to
well,
help assist with that in
hopefully,
the near future?
yeah, hopefully we would try to organize a group to go over there and visit and raise awareness about malaria prevention and see on the ground what's going on. Like we brought groups to Africa. I've never been to Papua New Guinea, but I suspect that if this goes, I'll be seeing Dr. Munier in person, and maybe some of these other folks on this Zoom would come with us. But
Okay.
this is an opportunity to do stuff later on, but right now we're just trying to get people to learn about malaria, join our Rotary Action Group, log on the website.
Okay, yeah, and I'm going to look to James in the community. Apparently, Brian on our Zoom right now too. He has been to Papua New Guinea working on projects also, so we've got quite a bit of experience here. And James Ham is over there now. But I would say too, the other thing is, and I'm assuming it's on your website, with the excitement that maybe we go sometime in the near future. I'm assuming I have to, if I wanted to go, I'd need to go see my doctor and get all kinds of vaccines done myself. So would that be there if we were to start telling people, okay, if you think you want to participate, go take this regimen of shots, or you wait till you know you're going to go before you get get that many shots?
No,
Um,
no, don't worry about the shots. There's not there the malaria vaccine is only indicated for young kids right
okay,
now. But there are medicines that you would take pills while you're over there.
okay,
And it's quite simple. Like I said, I've been to Africa a lot of times. Luckily, I haven't gotten malaria, but I have used those pills. And there is a new medicine coming along called monoclonal antibody, which will be a one-time shot that gives you the immunity for when you travel overseas to a malaria zone. It only lasts for probably 3 or 4 months, but it's being tested currently. So that would be exciting if we had that.
because that could help you make sure you don't become a carrier and take it to other locations.
That's one of the things, yeah. Plus,
Okay.
make sure that you don't get sick. And if you didn't take your pills, for example, this is given to you as a one-shot deal, so it protects you for a while.
Okay. Sounds good. Okay. Yeah, I think what we need to do is get into your website, get all the information we can, get James. Oh, there's James back. His name's back on board there. And then because we have some other things on the agenda for today, but then we can look at how realistic that is for us to try and fit in there and at what position. Um, we've got a lot of really great Rotarians here in Hawaii, and as you can tell, obviously a lot of them do traveling. I think there's a lot of desire to help our Pacific Basin. I mean, there's trips all over the world, but Pacific Basin is clearly something. I know I've been involved with some other projects in this Pacific Basin because that's we have a lot of neighbors, and they're all right here in the area that could have just had our tidal wave yesterday. So those are our neighbors that we worry about. So yeah, thank you. Do we have more questions from everybody on this Zoom?
Yes.
Brian, you had your hand up. Yeah, go ahead.
Brian, go ahead.
Hey, Dan, I joined the action group in March. I haven't seen a newsletter since then. Is there separate lists or has there just not been one?
There has been something happened. I
Okay,
don't.
I'll try to rejoin. I just logged in and it accepted my login. So.
Okay, what's your email? Let me look you up and make sure it's
Sure. And I just sent you an email through that joining, actually. It's brianhartness@gmail. So just my name there, one word.
okay. And I can add you on, Nancy, if you want to give me your email too.
Okay. Yeah, I'll send that. I'll send that in the chat. I'm gonna give you my regular one, not my long rotary one. Okay.
Okay, that's great. Well, I
Good.
appreciate you guys working on good projects, and it sounds like there's interest, and we'll see what happens. Thank you.
Dr. Perlman, I have a question.
Go for it.
I was in Papua New Guinea last year with Dr. James, and I saw a Jeep with a logo on the side. I forgot the name of the organization, but it was an organization that was fighting malaria in Papua New Guinea. Was that your Jeep or
No,
Yes.
no?
that was his Jeep. Yeah, there you go.
Our Jeep, the
Oh,
Rotary Against Malaria Jeep. Yeah.
yes. Oh,
So countrywide, we have 55 Jeeps, and like we are doing almost 90% of the national malaria response in the country.
okay.
So Rotarians are already involved in malaria in Papua New Guinea. They have the Global Fund grant that has been going on for several years. And so this is to increase their involvement. And Rotarians were pivotal in getting rid of malaria in Timor-Leste, which is another big island in the South Pacific. And that was just announced last week that it became the 48th country to eradicate malaria. So we are involved and we are getting more involved. So,
Cool. Hey, can you guys hear me?
Yeah.
yes.
Yes.
Okay, good. I'm back. I don't know what happened, but anyway, I'm back. Just want to say thanks, Daniel. I didn't get to hear all of your presentation, but I appreciate. Let me turn my screen off. Can you guys hear me better?
We hear you fine.
Yeah, we hear
Okay.
you.
All right. I think the screen just keeps cutting out, but just want to say thank you, Daniel. Also, just like I said, we all know that it's an uphill battle, but without the support of Rotarians keeping that ball rolling, it's not going to happen. So I appreciate all the work Dr. Majid is doing as well, and all the amazing things that you and your wife have been working on across the world. But happy to discuss this on our own and as a district and as a team, and we'll get back to you. Appreciate both you guys, and thank you so much for joining in your busy day. Thank you.
Thank you. Hope to see you again soon. Thank you very much. Great information.
Great. Thank you very much for having me. I'll
Okay.
get off of the chat now.
Good. Thank you. Yeah, we'll see you again. And some good information. Murray, you're just all over the place. So you've been in Africa since we walked over there at the district conference for polio.
That's correct. Yeah, I just made it to the conference. I just came back a week
Oh,
before the
wow.
conference.
Yeah, fantastic. Okay. Okay,
Well,
let's let
yeah,
you
well,
take over.
yeah, well, yeah. I wanted to go over some Rotary business at the beginning of all this, but it looks like our guest speakers kind of jumped in. I don't know if it's
Yeah.
appropriate necessarily to talk about this, but I think what I'll do is since Lorenzo's already on board, or we're a little bit late on time. I don't know how much time you got, Nancy, Dave, and Naomi, but just wanted to obviously maybe the four of us could end a little bit at the end of the meeting. Maybe we could just stay on the chat and talk. If that's okay.
Yeah. I'm
then,
available.
Yeah, thank you. No, and I just I think I had it was like I said, it was trying to cram in too much like I always do. But
Yeah.
well, without further ado, I just wanted to thank Lorenzo. Lorenzo's working night shifts in the Straw VR, and I'm the clown who actually scheduled him for those night shifts. So I'm kind of partially to blame for it. But Lorenzo actually is the kind of the driver and the one that kind of sparked that interest in a potential trip to Chuuk for us,
Yeah.
as well. This pretty awesome VTT project. I don't know if you have any slides, Lorenzo, but just wanted to introduce yourself. I'll let you introduce yourself, your background, what you do, and how you came about what you're doing. Thank you.
Awesome. Thanks so much, James. And hello, everybody. Thank you so much for your time and for having me. I'm an emergency doctor here at Straub with James. He is, like he said, responsible for everything that I have no responsibilities because of James. And I do have a few slides that I've shared with the Pohnpei Rotary Group that maybe I'll share with you guys too to get you up to speed to what I've been doing in Micronesia. So just give me a hot second here. Okay. Everybody see the
Yeah,
slide?
yeah.
Good.
Yes.
So this is me and my wife, Dr. Scylla Ball. She's an ophthalmologist. We have been working in global health for many years, and the last 2 years we've been focused mostly in the North Pacific, in Micronesia, specifically in Chuuk. This is a picture from one of our trips there that coincided with the Mercy ship coming on board, and so that was a really fun time to work with the Mercy Ship staff. We had already been there for several weeks, so we kind of acclimated them when they came into the hospital to the situation and the resources or lack thereof, and worked together and got a lot of good supplies from them too, because we were their last stop. So for everybody, we have a lot of Micronesian folk that
Yeah.
live with us here in Hawaii, but it's kind of incredible to get an idea of the scale of their country. There's only about 500 square miles of land in their whole country, but their territory goes over 1 million square miles. It's in the North Pacific, near places like Saipan and Majuro, the Mariana. And most of my work has taken me to Chuuk in Ueno specifically, which is their main island. But hopefully through more work with the grant that I've been working on in the Rotary Club, we can expand to other states like Pohnpei. So come on. So I started, I don't know why it's doing that. I started a nonprofit. Sorry, guys. I don't know why this simulation is annoying. Here, let's go like that. I started a nonprofit to facilitate getting resources into places that I do my global health work. I started it during my fellowship in wilderness medicine while I was working in Samoa, working with emergency physicians there and teaching them ultrasound. I started this nonprofit called Rose Initiatives to facilitate getting donations and equipment for the global work that we do. And we've expanded this project, and now it focuses primarily on ophthalmic care as well as emergency medical training. So we basically work through capacity and skills strengthening and some infrastructure strengthening as well. I, Scylla and I spent probably about 6 months in Chuuk over the last uh, 2 years, 4 to 6 months in Chuuk, just doing, she was doing surgical eye care, providing teaching to the surgical technicians and OR nurses, and I was doing infrastructure strengthening and an analysis of a needs assessment of the hospital system as a whole through different departments. And so what we want to do is empower the communities via the trainer model, by trying to teach the people that are already there in a way that is providing more long-standing performance. So the North Pacific, like many places in the Pacific, has some of the highest rates of preventable blindness as well as other poor health outcomes because of its geographic isolation. It's very hard to get supplies and equipment in. It's very hard to get people and staff in. And then they also have a lot of multiple burdens of disease, both from non-communicable When talking about eye care, we're talking about cataracts, we're talking about infections like toxoplasmosis, climate-related effects such as the high UV light exposure. This contributes to a high rate of blindness. And then there are also a critical shortage of healthcare facilities and workforce. And so, in the hospital in Ueno, which is the only hospital in Chuuk, there is one surgeon who's full-time. The other surgeon is sort of retiring. He has very poor vision himself, but he's still operating because that's all we have. There's one OBGYN. There's, one or two internal medicine doctors. And a lot of these folks have various levels of trainings, and not to mention the nurses and nurses' aides are, sometimes lacking a lot in the skills that are necessary. Let me see if I can go back to full screen here. So from the eye perspective, what Scilla has done is perform these training camps for the ophthalmic technicians. She's actually invited OR nurses and ophthalmic techs from Kosrae, Pohnpei, and Yap, as well as the Chuukese, and kind of convened in Ueno and did a 2-week intensive training. And she's really proud of the team that she's assembled in Chuuk, because it went from an OR staff that had essentially no idea on sterility practices and OR safety. You had like sandwich wrappers in the operating room next to somebody who's getting an open belly surgery. And so just kind of going from the bottom up in terms of getting the algorithms sorted. We also did a mobile outreach pilot where we traveled to the different islands in the lagoon in the Chuuk Lagoon. And that was really rewarding because we got to see a lot of these patients that just are not able to travel 1 to 3 hours by little boat in choppy waters because of anything. They're elderly, they have hip problems, they're not ambulatory. So this was really fun. We got to give out a lot of glasses, do some cataract screening, see for the people that could travel, screen them for operations back on the main island. And more than 120 surgeries have been done with many hundreds of glasses, at least 1,000 patients treated for different conditions from glaucoma to diabetic eye conditions. So it's been really successful. When I'm not in the emergency department there, working with the staff in the hospital, I travel with Scilla to assist with the trainings to the different islands. This is some of her staff that is now, her second family over there on the left. Happy patients here, and I get a nice reward of fresh coconuts to go home with. And we always get fed delicious fresh fish. So here is on the very left, we have Dr. Padwick. And he's interesting because he's the only ophthalmologist in all of the Federated States of Micronesia. He is based in Pohnpei, but comes to Chuuk to perform surgery. And Scilla, every time we go, we kind of coordinate, okay, Chuuk, Padwick, you're going to come to Pohnpei, and she teaches him laser techniques and different cataract and surgical techniques that improve his practice and ability to deliver care. We have Jojo next to him, which is the one of the 2 surgeons in the hospital. He works literally, he's always at the hospital. It's incredible. Next to him is Marta, who's the anesthesiologist, but she's not. She's actually a nurse who was an OR tech, was taught skills by an anesthesiologist for a few months, and then the anesthesiologist left. So she's the only person delivering anesthesia care for surgeries in the hospital, which is very impressive, and just an incredible person. And then Chico here, he's coming with me many of the times. He's a well-beloved trainer in the region that does a lot of education.
I just wanted to add, Chico's also a paramedic instructor at Kapi'olani Community College. He's not Chuukese, he's actually from New York. And he's actually on a rig right now taking a 911 call with EMS because he's on the job. So he was going to join us, but he's been instrumental to us in other projects as well as Dr. Paul Morose's Palau project. Sorry for interrupting.
No, thank you for that. Yeah. Chico and I intersected on one of my trips to Chuk, and I realized, how, first of all, what a great educator he is, and how well loved he is by the community in Chuk. Everybody just jumps to sign up for his BLS, ACLS, whatever training he's interested in doing. And so I've uh, hired him through Rose, through our Department of Interior grant, with which we've done this work, to come back with me to keep working. And so, from the emergency care perspective, I performed an extensive needs assessment, not only of the emergency department, but also of their surgical medicine and pediatric wards. I assembled a multi-page document with basically equipment, supply recommendations, and systems recommendations that I provided to the leadership in the hospital. And that's been sort of the ongoing document that we've been chipping away at. Through the Department of Interior grant that I was awarded last year with Rose, we've been tasked to return to Chuk 4 times over 2 years. And so we've gone one out of the 4 times to create a medical training sim lab. And so that first time was the biggest lift. We brought about $70,000 worth of equipment, supplies, and training tools, and turned this basically derelict closet in the back of the hospital that was just a storage room. We got some elbow grease going and just cleaned up the area, painted it up, and started putting our equipment in there. This is Chico setting up our IV arm mannequin. We have EKG simulators. We have CPR simulators. We had a whole schedule for the training lab. We had a ceremony with administration and state officials to open it with a ribbon cutting, and everybody in the hospital came through for just to play with the equipment and to start doing some training. And we did different stations. So this is a pediatric simulation mannequin. You have the emergency doctor and the surgeon sitting next to each other performing endotracheal intubations. Here's some hemorrhage management that the docs and nurses are working on together. So it was a really fun time, just team building, getting hands-on with these skills that they just, have a hard time getting from day to day. Oftentimes, people come from outside, they'll do an hour or two lecture, maybe they'll stay for a day or two, and then they leave, and this is all they have. So now they finally have their own space to work in, and that they can keep going to as much as they want to practice and to refine their skills. And so we're going back in November, and then Q2 and Q4 2026 as a part of this grant. And James was kind enough to suggest, the Rotary could have some part in this. And I think that would be a really exciting avenue to be able to pursue expanding to Pohnpei and kind of getting that collaboration across the states of Micronesia and foster those, healthcare worker relationships. What I'm thinking about is getting some of the local providers from Pohnpei to travel to Chuk to do some training in the new sim lab that we've set up, get their ultrasound levels and skills raised a little bit through donations of equipment, and from a more of day-to-day, I guess you could say, layperson activity. They have an incredible burden of nutrition-based disease. They have ultra-processed food. People aren't really cultivating the land that they have. They don't really know what is a good, healthy diet. And so high rates of diabetes, high blood pressure, kidney disease. And so just getting people to come by and say, like, this is what we need to get to be at a better health level through edible gardening skills or health and nutrition fairs or eye vision screenings. These are just some ideas that James and I were having, and we had a meeting with the Pohnpei Rotary. They seem very excited about it. They've signed on to be our international partner, and so we're in the process of finalizing our application to the grant. So thank you all. I appreciate your time. I'm going to stop sharing now.
Well, I have one question right off. That you just now mentioned the Pohnpei Rotary Club. So are they really a good club participating and supporting all of that? Because okay, I see. Because I'm learning that that's so critical to everything that we do. We need to have that sister Rotary Club somewhere in the area to help support our activities, and otherwise it's really an uphill battle. So, okay, good.
And Nancy, it was the coolest thing ever. In one meeting, not only did we present, then they actually voted, and then they approved to support whatever grant we were supporting and moving forward with. It was the coolest thing ever. And so that's where Lorenzo and I and Paul Morose were talking, and we were kind of finding like a way for us to support this. And obviously, we like to draw a line, kind of not literally, but just two things, right? If there's a VTT program specifically that we could help with, and I think getting the other doctors like from Pohnpei, et cetera, to come to CHOOK and utilize this training center and provide a train-the-trainer program. Create, I think a VTT like that might be super beneficial for overall. Also add in like maybe a video, like a Zoom kind of component where we can do like a communicate with them, provide some equipment for them to communicate that way for a long-term vision, a sustainable plan for them to advance, emergency care, critical care, eye care, surgical care, et cetera. On top of that, on the other side would be this potential trip that Lorenzo nailed at the end of his presentation would be kind of medical, non-surgical ways for us to help in the community, whether it's through water sanitation hygiene, whether it's through eyeglass fittings, whether it's through health promotion, through nutrition, growing vegetables, just basic type of things that Rotarians are really, really good at. Rotarians are really good at doing those things, and spend a few, create these. And there's even like a specific place in CHOOK where they could actually have this happen. There's like a space that logistically I think people said would be a perfect place to have this happen. And there's also, I know Lorenzo can tell you, there's a real good place for the Rotarians to stay.
Okay.
It's safe. These are all things that we've kept in mind. And again, this kind of checks all the boxes. And I know that the past 3 district governors have all kind of had this idea of wanting to do a project, either in our own community with the micronesia community, but also maybe abroad. And I think this is it's finally lined up, and it's about that 3 to 4. I feel everything for me, my life seems to be a 3 to 4 year kind of lead up. I feel like, but it's finally coming to fruition, I think.
Good. Now all the pieces, lots of pieces to that puzzle. So there's some really key ones, and clearly James and Lorenzo, we're going to be looking to you folks if we can put this together. And I'm assuming put together a package that we can go out and see what kind of money we can put together from our clubs. And then also if we're going to be able to have people, want to travel there. I think I find that the travel to the site is a key component with Rotarians that I talk to for their long-term commitment to an area, because once they've traveled there, I think a lot of them feel they see the huge need then, and you just want to do more and more, and you're willing to, encourage others to open their wallet and or make the trip and try and do more. So yeah, if we can, that's your committee though, James. I'm going to look to you and your committee to see what we can put together here. Okay.
James, this is a VTT project. Has the VTT been submitted yet?
No, that's what we're working on right now. We're in the process of trying to. We wanted to get the support, first of all, of the district, but secondly, nail down the actual details, the nuts and bolts. I know that Lorenzo mentioned earlier about this Department of Interior grant. Obviously, we're not trying to collaborate too much. The idea is to have clear, specific things that the Rotary grant will fund. That's different from what's already happening. I personally think that the training to expand across the other state, to Pohnpei, et cetera, is definitely something that that's in addition to. On top of that, the advancement. Lorenzo mentioned ultrasound. Lorenzo mentioned maybe some other advanced things that we could provide, and I think that's kind of the key. That the basics of the training simulation center is set up there by the Department of Interior, but the actual training, the actual people going there to actually get this done is going to be a different setup. That's what I'm trying to use this VTT terminology, because the things there may be purchased by the Department of Interior, but the actual training itself is the funding that's lacking. So it's the people stuff that's lacking.
Yeah.
And we could add in some more specific things. And I think, again, some things that are portable, that are easy, like ultrasound are key. But yeah, I'll have a more detailed talk about this. I know, Dave. I know that the time is of the essence, right? With getting this grant going, and I think Lorenzo's already submitted or drafted a proposal for this. And we're working on this together. Honestly, I just need to personally, to be honest with you, I've been swamped too, so I just need to get through that as well with them. So maybe that's.
Oops, you just froze.
You froze.
Yeah.
Yeah, take your picture off, then maybe that'll help. I know that video takes up space.
Yeah.
Yeah, I would be
James,
interested in knowing what your budget is, what you're looking at as far as expenditure amount. VTTs do include travel, but it would be only the essential people that are doing the training, and that would have to be people that could not be that don't have the skills within Chuuk or Pohnpei. Yeah, we would like to see a little bit more about what the whole scope is of the VTT.
Yep, that sounds excellent. And we're working on the budget now. So once James is back from PNG, I think we'll have something headed your way soon we'll have some more numbers for you to work with.
Okay, thank you.
okay, good.
So Lorenzo, was Noel Boylan part of that group in Pohnpei for the Rotary Club? Was there a Noel Boylan?
Let me see. I don't remember that name. I don't remember that name. Noel? Or no.
Okay, so I gave that name to James because our sister club in Kyoto did a project with the Pohnpei Rotary Club to do a global grant in Tinian Hospital. And so they had a MD and a ophthalmologist that went, and they bought a portable echocardiograph machine for that hospital. So because they've already worked with the Pohnpei Rotary Club and they were happy with the results, and it went smoothly. They closed it out and they were able to do it within a year. So that's why, Nancy, I know that we can trust the Pohnpei Club.
Okay, good. Yeah.
Yeah, they seem pretty eager about the project, and there was a little bit of like, oh, well, all of this work you're planning is in Chuuk, like what's in it for Pohnpei? And we were like, well, that makes sense, and we're planning some collaboration. I think the biggest thing will be a longitudinal relationship and having the Pohnpei medical folks be able to travel to Chuuk and vice versa to use the equipment that we provide. So I think hopefully it'll be a win-win for everybody.
Naomi, do you see any issue with regards to the VTT covering the cost of the people from Pohnpei to be traveling over to Chuuk for the training? Normally, the cost of travel is for the professional talent that's coming into Chuuk to do the training, but not for local traffic. And I just want to make sure that that's clear and at least accepted by Rotary International, if that's the plan, if they will accept the cost of them traveling, but I don't think they will.
Lorenzo, was that part of the plan for them to go?
So I don't have experience in Pohnpei. Just to be transparent, my experience is in Chuk, so I don't know what the hospital system is like. I'm happy to sort of explore the Pohnpei hospital system and healthcare capabilities. But my plan, at least for this initial work, was to, because we've already set up this very nice sim lab in Chuk, and we want to establish this collaboration, get some of the Pohnpei staff from their hospital to come to Chuk. So that was our goal. But if you think that that's not possible, we can sort of try to go back to the drawing board and figure out another way. Because I think that the Pohnpeians want
it might be one, Lorenzo, where you're going to probably be thinking about seeing.
Go ahead.
Yeah, we may want to see if there's any possibility of us having that in Pohnpei.
You're froze, David.
David, you're freezing up too.
Yeah.
And then the VTT US. Am I breaking up?
Yeah, you're breaking up. So
let me shut off my video.
yeah.
I don't know if that helps, but can you hear me okay now?
Yeah, now we can hear you better.
Okay, so the question is if we did it at Pohnpei, then we could possibly say, okay, the cost of travel to Pohnpei from your team, Lorenzo, over to Pohnpei could be covered, and any professionals that are coming from the US or other locations going directly to Pohnpei for training could be covered through that VTT. But I think if you bring professional training over to Chuk, and then wanted to bring people over that are being taught from Pohnpei, we wouldn't be able to cover their costs, but we would definitely want to have somebody from Rotary International to give us guidance in that area.
I got the impression you wanted to have some of the doctors from Pohnpei or the medical staff people from Pohnpei go to Chuk to help with the training of Chuk medical or staff and then they'd have a closer relationship to help each other. Is Pohnpei more advanced in their medical ability and equipment?
Yes, I think that is true that they are better off. Chuk is a very destitute place. I've never seen a worse healthcare environment in my life. It was really traumatic, and I think Pohnpei is much better off. So I just don't know that we were going to have the sort of impact by focusing our effort in Pohnpei. But like I said, I haven't done a needs assessment there, and so I think it wouldn't be too wise to just jump right into Pohnpei with kind of right off the bat.
Yeah.
That's why it's kind of an initial start to get the Pohnpeians over to Chuk. But again, if that's not, I'd appreciate just seeing if that's even in the cards. And if not, we can figure out another way that so that the Pohnpei club feels like their state is also being represented.
Sorry, Nancy, for cutting it out, but
yeah, no, the reality of our world.
Yeah, and just to dovetail on Lorenzo, I don't think you necessarily need to. I know you want to be very proper, Lorenzo, and you want to kind of keep each state kind of separate, and in terms of but overall, for the sake of the project, for example, when we did this ultrasound project for Papua New Guinea, we had people from 6 different areas, right, come in, and we didn't have to necessarily do a needs assessment overall. We just knew that healthcare in general was a need, and this training is kind of like a universal training. So I understand what you're saying in terms of kind of specific needs for specific places, but I think general overall, the needs assessment could be like a universal one.
Totally. I was just it was just a part of the broader conversation that Dave brought up. I think you had popped off that he does not think that the Rotary International will be able to pay for Pohnpeians to travel to Chuk.
Oh no, it happens all the time. We did it for the ultrasound grant. We flew everyone into Mount Hagen and trained them all. It's a no-brainer.
Yeah.
We do it all the time.
So you'll be bringing people to be trained over in Chuuk from Pompeii, or is it the people
correct.
from
And the
Pompeii
rationale is that Chuuk has the sim center built.
Yeah, they're coming to be trained, not to train.
Okay.
Yep.
They're not the trainers. The Pompeians aren't the trainers. They're actually coming to be trained. So and it's a two-way street. It works both ways.
Okay.
Yeah, there's actually specifications in the grant for that.
Yeah, I apologize if that wasn't clear. Yeah, the only trainers would be coming from the US, essentially.
Okay, that's good. That should help put that together, and then we can see what we can amass as fast as possible to have this happen soon. Yeah.
Yep. I think instead of having this multi-phase thing, I think just putting it together and saying this is what we need and go for it. Because I think as soon as we get submitted to RI, again, I know Dave is trying to kind of sort of be a devil's advocate to say, hey, this, maybe we need to not waste our time on certain things because it may not happen, might get kicked back. And I'll be honest with you, I'll tell you, I don't want to, I just, the water project here is going to get has got kicked back twice, and I don't know if it's going to happen. Just straight up, just from a foundation perspective, we wanted to wait on that, but so we'll have extra DDF from this water project that didn't happen, and clubs will still have their club cash to spend on another project they need to, because it's unfortunately, it's kind of like me telling a patient that their family member passed away, right? I'm going to just tell you straight up, this water project's dead.
Oh, is that officially gone, James?
Yeah, I'm sorry, guys.
Literally,
as of yesterday night, Wednesday morning, I went over to the site. I failed to get the things we need to get. Face to face, I was told straight up it's not going to happen again. And then I had a meeting with the Vertical Mount Hagen, and we just collectively agreed. I went through all the stages of grief, guys. Denial,
that's
anger.
So sad. You worked so hard on that.
Finally, I'm in acceptance, though. But like I said, you win some, you lose some. It's a massive embarrassment of mine. I'm glad we haven't spent any money. The checks that were sent were held, so we're not. Obviously they're massively backdated and probably not even valid anymore. But at least clubs still keep their money. I'm going to tell these clubs, hey, sorry this has happened. But again, back to back with the, I know Steve's on the call here with the Fiji grant. These water projects are hard. These projects are, these building projects are difficult in an area of the world that's very difficult. And moving forward with projects that I think are successful are these projects like Dave's projects where bringing medical equipment. The Papua New Guinea one, same thing, bringing medical equipment, bringing training. That's why I think this project, despite having a lot of uncertainty, we don't have to rely on someone there to build something. We have to rely on someone there to provide us this, these complicated things.
So the nursing school got city water, right? Is that what happened? Part of what
correct.
Happened?
So it's a win-win.
At least they have water.
Yeah, in the 3-4 years that this grant was being developed, the country developed without us. That was the beauty of it, right? They were able to get city water. They were able to get.
That's shocking because it was so. It was close but far, at the same time.
Exactly.
It was such a rural, rough road between Kundiawa and the school. So I'm shocked they were able to get water. That's amazing for the students. So that's great.
And to solve the problem with the nurses, unfortunately, getting assaulted, trying to go get water and going from school, they built a police barracks right there. So there's this principal is amazing. He's not. I don't consider him a failure. I don't consider him no animosity. This guy's amazing. He's doing the right thing. We had a moment 3 years ago when they were in drought and they needed water. And he chopped the bat sign, and Rotary came out to help. And since then, all these things have happened. And Murray was there when we discovered this water source, and I immediately was like, oh geez, right? Because good way though, right? And I'm glad for them, but at the same time, I realized that our project was to provide water. And they already have it. So then we tried to shift it into something else. Let's talk about water purification and other stuff. We know that high-speed water purification systems are super expensive and complicated and can break down and require testing, require all this technical stuff that's difficult to find there. So in the end, let's move on. We're fine again. And I know Lorenzo's here. I don't really want him to hear this, but if there's funds for us to use in other projects, let's do it. And we could let's do it. Let's do the right thing and just move on. Not have to.
Is the water clean? The water they got, is it pretty clean? Or?
It's not yet, Brian. We're working on ways. Yeah, we're working on other ways, non-rotary ways of making it happen. Right. So the water handhold team will be working on that still, and like I said, it's a work in progress. But like I said, yeah, and I'm still planning to go there through other means, and I think that it's gonna be, this guy's awesome. You know, I've known this guy for what, like 10 plus years now.
Yeah,
And
I really like presenting to the students and stuff. They're great students. He's a great, the faculty is amazing there. They're so devoted. I love that school. So I definitely still want to help with What Our Hands Hope for sure.
Thanks. And okay, let's see if others let's see.
So James,
any questions? I'm sorry, no, sorry, go ahead.
so going back to Chuck, the part about the Rotarians going to do maybe the nutritional fair or the health fair, that's a separate grant, or is it going to be built into the VTT?
Well, that's what I was going to ask. You know, very similarly to the project in Nepal, right? You know, it's you know, we have a, you know, or even like the project we did in, I guess more like the Bali project, I guess, right? How are we evolving this? That's what I wanted to talk to you guys offline about. You know, resources available and what's needed, right? And so I imagine it to be a separate thing where, you know, these things don't cost any money. If we need eyeglasses, we get Lions Club to donate them. If we need, you know, help with providing lectures and things like that, we just go there and do it. I mean, it's not a VTT that Rotarians need to go there to volunteer. You know, so I think a lot of the stuff we could kind of pull off without. And the reason why I say that is I don't want. No offense, Lorenzo, but if the grant doesn't, if the VTT doesn't happen finance wise, so be it. We can still go there and you know, still go there and do work as Rotarians, and the grant's coming, right? So it just so happens that the stars all align. While obviously it'd be awesome if Lorenzo, Scylla, et cetera, could come at the same time, you know, and we could make it happen, and or else have other Rotarians come and help. But I think having it split would make it easier, you know, and having planning process will be easier, so that because you know, you're always going to get Rotarians, and Murray, no offense to you, but Murray's always asking like, hey, I'm not a medical guy on this trip, how can I help? I'm not a medical guy. So by calling it this like VTT for surgical stuff or medical you know, emergency care stuff, it's going to be it's kind of hard, right? So by having it separate and saying, well, hey, maybe the opposite, maybe the Rotary trip is the kind of the hallmark, and this VTT thing is on the side, right? But regardless, I think you know, how you want to sell it, you know, I think getting Rotarians there to do help, Rotarians going there to have their Rotary moment, I think is going to be key for us to do this. And I think, again, how cool also would it be to get some, remember, I think the coolest thing was Murray serving as one of our quote unquote dummies, right? Doing ultrasounds on Murray. And Murray get involved with equipment and making sure that we could get, you know, the equipment, what's it called, cataloged, and you know, make sure that everything was, you know, was set up properly. Yeah, just, you know, I think there's definitely a role for Rotarians, and yeah, I really liked hearing, you know, so what I think of this as is a little bit of what Beth and Jim and Jonathan Okabe do when they go to the Philippines, is a health fair kind of things that they do that are very low cost, but personnel involved, and then mixed in with the Nepal project that Naomi and Arjun were a part of, that we could then you know, something in that sense, right? Where we have something more focused and isolated, focused rather than us, and it won't be remote. The other cool thing about this is it'll be centralized. So it'll be kind of what we envision is like a central location with maybe like almost like a farmer's market set up, you know, with different tent areas set up. And then from that area, the trainings could happen in different parts of this giant field or this giant area. And having more of a centralized thing, it could be multi-day. So we're not going to a school or going to a location telling them, hey, this is how it's done. It's more or less people are invited to this maybe a week-long setup of trainings, and you know, they can learn about this stuff, they can learn about that stuff, and it's almost like an event, like a something like that. But
Okay. So you as you said, let's talk about this offline, but we need to get going on this. So when we back, we got to get going on this.
Okay, if you guys don't mind, I guess I'll just officially end this IST meeting here, and then maybe a few of us could just, maybe Naomi and Nancy and David stick on. Does that sound fair? I was hoping Arjun would jump on too, but I do think we need some facts. We need to get some things clarified from the district, which is kind of what options are, and especially with this other grant. And to answer your question, Marie, yes, unfortunately, this WASH project's not going to happen, unfortunately. Which is, like I said, it's maybe it's a good thing, you know, in terms of energy level and focusing on something else here. But yeah, okay. Well, I'll just officially end the meeting here. Lorenzo, thanks for jumping on. Sorry for all this, you know, coming on and off stuff. Hopefully my connection lasts. but we'll go from there. And hey, have a good shift tonight too. Thank you.
Thank you, everybody. This has been rapid but very informative and diverse.
Nice meeting, Doctor.
Yep. Malaria, Chug, Pompeii. Lots of places to spend our time and money. Thank you. Thank you. All right. Thank you very
Thanks,
much.
everybody.
I'll stay
Yeah,
on.
bye.
Okay, James, I'm staying on. Naomi. Yeah. Thank you. Thank you.
Right. Have a good evening.
Yeah, thanks, Steve.
Thanks, Steve.
Let's
All right.
let's get Fiji over the hump here too. And in your, I know I see you working on it.
Yep. Hopefully the foundation gives us the money.
Yeah, there you go.
All right. Have a good evening.
Okay, thanks, Steve. Take care of your
Bye.
nene.